actually went through. John Adamson with Seeking Light. Thank you for watching today. Yes, I am wearing the same sweatshirt I wore yesterday, but I do have a clean shirt on underneath. So anyway, the other day I read to you a letter that I sent to the vice president of human resources at the hospital organization that I do PRN work for. And if you're not a medical person, PRN means as needed. And as an unvaccinated employee, our hospital still is requiring vaccinated employees to go through weekly testing, the wearing of an N95 mask, and there's some other regulations that don't really impact me. And then, of course, we had to file for religious exemption, which I did, and I successfully got. But I wanted to share with you, first of all, I'm going to reread the email that I sent, and then her response I received today was very timely. And I was surprised at the speed with which she got back to me. So here's my original letter to her. With HCA, that's the name of a large healthcare organization throughout the United States. With HCA and other larger healthcare organizations rolling back their own vaccination mandates in light of the Federal Circuit Court's decision to block as unconstitutional any healthcare vaccination mandates from the federal government. I'm not going to say it, but my healthcare organization I work for. My healthcare organization would be justified in eliminating its mandate. So they've kept theirs. When considering the number of available jobs in both organizations, HCA compared to my organization, according to their posted listings, and the number of dedicated healthcare workers who are left due to vaccination mandates, who are now choosing employers that do not require vaccinations, N95 masking, or weekly testing, it appears that my healthcare organization would be greatly benefited in its recruitment efforts to fill these needed positions that help make us the regional healthcare employer of choice. Key to a hospital organization's public perception is the availability of care in a timely fashion, achieved by a well-staffed institution. A Google search of my healthcare organization versus another healthcare organization that's their competitor that's under HCA, as of this writing, reveals a 2.3 out of 5-star rating for my healthcare organization and a 4.1 out of 5 rating for the other hospital. And so this other hospital, again, no mandate for its employees and less open positions. Public perception of the awesome potential we have as an organization would be greatly helped by bringing on qualified staff who have opted to not get the vaccine and who do not wish to go through weekly testing and mandatory wearing of the N95. The elimination of the N95 full-time wearing and weekly testing will also reduce costs for the hospital and goes a long way towards enhancing an atmosphere of mutual respect amongst vaccinated and unvaccinated employees without visual reminders of the separateness between these groups. The toll on the morale faced by non-vaccinated employees has been evident in the conversations I've heard and been a part of at my weekly visits for the testing. Furthermore, as data is demonstrating that the Omicron variant is both more transmissible and much less virulent than Delta, making it soon the predominant strain of the virus, herd immunity is nigh. As studies have also demonstrated, the prevention of transmission previously afforded by the vaccines is negligible now that the Omicron strain is here, making a distinction between employees in N95 mask wearing and testing unnecessary. I'm writing this in hopes that the management of my health organization will eliminate the N95 full-time mask wearing requirement and weekly testing for all employees. So this was her response to me. Hi, John. Merry Christmas to you and your family. I'd greeted her too. Thank you for your thoughtful email. I know that it is getting confusing with all the changes to the vaccine requirements. Well, it's not confusing to me. It's very clear. I care for this lady. She's very nice, but it's not confusing. It's a mischaracterization of what I'm saying. Um, we, meaning the organization, are closely monitoring all actions in this ever-changing process, as I'm sure they are. So let's continue. We are also monitoring our COVID cases, not deaths, not hospitalizations, just determined cases. Um, let's continue. We are monitoring our COVID cases and associate exposures, and unfortunately, we are headed in the wrong direction. I'm not sure you tune into the town halls and on Facebook, which I don't. I mean, I've read some of the town halls for my healthcare organization. I do see the numbers of people that are inpatient. This is the time of the year where you're going to see a spike of inpatients. But what we're starting to see, and this has been evident, the CDC has tracked it, is the percentage of people that are duly vaccinated ending up in the hospital is grown substantially compared to the unvaccinated. So it doesn't say anything about vaccination status here. Okay, so we share our daily stats. As of yesterday, we have increased the number of hospitalized patients to 58, and our associate exposure have continued increasing. Well, if you have more patients in the system with COVID, your exposure to your associates is going to go higher anyway. That's natural. That makes sense. But the exposure, being around that kind of person, doesn't necessarily mean you've contracted it, nor are you in danger. I heard a situation just the other day where somebody had an exposure and they were sent home, even though they had no symptoms whatsoever. I mean, this is happening regularly. A person I work with, his son, who was exposed but asymptomatic, was sent home from school for 2 weeks. No symptoms, no problems. So anyway, this is the world we live in. Let's continue. So since Friday through yesterday, we've had 7 new associate positive COVID exposures. Okay, positive COVID exposures. That doesn't mean anything. We're all going to be exposed to it. Are you symptomatic? Are you sick? What's going on? Were you vaccinated? Again, no information on that. We are looking at visitation, in-person meeting, etc. in our mitigation strategy. We will continue to require N95 and weekly testing of all non-vaccinated associates for the time being. We believe this is an essential tactic in our fight against COVID. And so I see people are sending in messages. Sorry, guys. I'll try to look at those later on. But anyway, she didn't address anything I said. And again, this is a lady I like. She's very thoughtful, kind. I know she's smart. This is the kind of political speak that I'm kind of used to, kind of talking around what I've pointed out very clearly. And the fact that the vaccines are not working as much as they were before and significantly worse, and that the Omicron variant is going right around them. We have the Moderna CEO stating publicly that he is very concerned that the vaccines we have right now are not going to be responsive to Omicron. We have researchers like in Africa and Great Britain has been really hit faster than we have, saying Omicron cases have, definitely been exponentially faster, but they're not nearly as virulent. Great Britain, for the first time, first patient reported a death of a patient with Omicron. Didn't say if they had been vaccinated or not. We don't have that information. We don't know the age of the patient. We don't know the comorbidities of the patient. So that information is next to useless to us. So anyway, all that I pointed out to her, for the most part, was not addressed. The vaccinated at my work do not, for some reason let me see if I can click on this. The vaccinated at my work do not. The Vax residents and employees have brought it to work. Yeah, I mean, I totally believe that. I mean, the transmissibility has been huge amongst vaccinated individuals. We just got a survey from my primary job today requesting information It's supposed to be a confidential survey. I did it. I don't care. Where you say, "Are you vaccinated?" And if you answer no, it says, "Do you plan to get vaccinated?" And if you say no, I forget what the last one response is, but anyway, we're getting this at work, and my big boss, who has been very respectful about this whole thing, and I know we have a number of employees that don't want to get the vaccine, but she was double vaccinated and got the virus, and got pretty sick. I suspect my family had the Omicron variant, actually. I know it's hitting rampant in the United States right now, and I've had a number of sickies. My wife's been staying sick longer, but she's been following the regimen that's recommended by the frontline doctors. Um, let's see. Somebody said, "Ooh, stay there." Oh, okay. Let me read this. I work at a huge Christian retirement community. Test every week. Ooh, stay with me. Sorry, for 2 years. I apologize. I'm not used to responding to live chat, but anyway. So I suspect all my family has been exposed. I mean, I swear I had it about 3 months ago because I lost my taste. And it's just mostly back now. It took a while for it to respond. So, and this is something we're seeing consistent. So I likely had Delta. I was really out of it for a day. After a couple more days, I felt mostly recovered, and then by like day 4, I was fine. And I followed a frontline doctor's recommended regimen, including I self-medicated. Don't tell anybody. Don't mention that to YouTube. And I ended up taking something that was largely panned as being dangerous. But according to studies that I've seen from India and what was the other country, where they actually dosed individuals with this particular medicine, which shall remain not named. And anyway, I got much better, kind of like Joe Rogan. I didn't have the monoclonal antibodies, but anyway, where am I going with this? So anyway, back to my letter. So she did not address my concerns, and if anything, you need. I would recommend you do. You don't need to do anything I tell you. But when you're having discussions with people about this stuff, you need to keep them on target. What are you stating? What are you asking? Because she's way off. I could call her out on it and say, "You didn't answer my questions. These are my points. Specifically, can I get a yes, no to any of these?" And I mean, she answered in part it, but she went around the points I was making. So if I would encourage you on anything is to make sure that you keep people to the message specifically. Because where communication breaks down, sometimes it's willing breakdown of communication. This is willing breakdown. This is political speak, kindly, but it's still political speak. And to somebody that's not discerning, not paying attention, it's easy to get lost in what they're saying and then forget what your points were. Always stick with your points. That would be my advice. Anyway, thanks for sticking around with me. Hopefully this is helpful. Any other points, comments that you have after this video is posted live, the comments you make, I believe, stay. I don't know if the ones you make during the video stay. I hope so. And I am going to be coming out with additional content. Just to let you know, I am getting close to being done with my course that I've developed on the ethics of medical mandates. And as a preview, I'm going to start doing little segments of it for you all on my channel, because it's gonna be a continuing education course for mostly rehabilitation professionals that a company has already indicated they're interested in. And that'll be a paid course, and they have a paid service for people. But if I want to run it by you all, because some of you have been with me from the beginning and talking about this ethical problems with being forced to do something, and I am making a case in that course that it is wrong on multiple levels to force people, and it goes way beyond the, oh, you're welcome, Jerry, way beyond this discussion of, well, just do it for, love for other people. Just get vaccinated so you don't kill grandma. That's a very simplistic, that word is used generally as a pejorative, simplistic view of the ethics in the discussion of this vaccine mandate. So, anyway, thanks again. I had 3 religious and 1 medical exempt finally got approved. Most companies won't accept medical. Yeah, I've seen that from others saying that they even at appeal, even at religious institutions, were denied their religious exemption. And I've addressed in other videos some of the common objections that people have gotten and how to thwart that, how to combat that, because they're bogus arguments. My 2 favorites are, your denomination says nothing about this, and if you don't take the vaccines, you can't take these 30 other drugs. And I've addressed both those arguments in other videos. Anyway, I hope you have a great day. Thanks for joining me. Take care. God bless.